Within the Northwest, we took the Energising for Excellence initiative, but we also put it alongside some of the work that we were doing to improve the standards of care within the Northwest in various organisations. So the first thing that we did was we embraced the directors of nursing and shared with them what our vision was for Energising for Excellence, to get them on board and to start to get the message out to their organisations. And I must say that they stepped up to the mark remarkably well.
The way we introduce it within the organisation is that we do have nurse development events, and within those events we've had a series of workshops which involves obviously our nursing staff from across all the areas, and it's getting them involved in terms of how they view it and in terms of how they think they can implement it within their own specialist areas.
I think it raises awareness of issues, but it also takes the focus back to the patient again, rather than just a job role and a task. It actually involves the patient, and everybody is an individual, and everybody's risk factors and so on are very individualised, and I think it encompasses all of that and makes sure that we set standards.
The one thing we don't want to do is for people to get complacent, and introducing something new keeps staff motivated, it keeps them enthusiastic, it demonstrates that we're striving to maintain high standards of quality and care.
The E4E certainly has embraced everybody. Certainly as ward managers, of course we want all our wards to be the very best. That is natural. There is some healthy competition there, and I laugh and I smile when I say it because it's natural. We all want to make sure we're performing to high standards.
I think the challenges in implementing E4E really are about communication and actually feeding it down to everybody, and because within the community we're not all in an office based or on a ward based, everybody's in and out and so on, so it's making sure that everybody is aware of the care indicators and so on, and how their particular role can actually influence and affect the outcomes of the E4E.
The key benefits of introducing E4E here at the 5 boroughs have been that we've been able to involve the nursing staff and the service users in actually deciding what's important to them to measure. It's not about maybe the SHA saying this is what we think is important, these are the targets. We've really contributed as an organisation to saying this is what we think we should be measuring, this is what we think demonstrates good quality, and that's looking at that from a staff perspective and from a patient perspective.
I think E4E benefits the staff by keeping them involved in what's going on, raising their awareness about national incentives and so on, and also about limited resources and how that we need to look at working more effectively and efficiently with what we've got.
E4E benefits patients because it really is about improving quality and standards, but it's also about patient outcomes. So it benefits patients by allowing us to look and identify any areas that we need to address, in particular areas where we need to improve our performance. By improving our performance, by making sure we have systems and processes and structures in place, then that will improve patient outcomes.
One of the main benefits for service users and their families and carers is that we're really recognising that they are an integral part of the care, and we're really instilling help and hope and support for them, which gives them a better journey, a better outcome, a better recovery.
The importance of the data collection, and from a performance point of view, is absolutely crucial. Very often it's not about ticking the boxes, it's about the outcomes from the initiative, and therefore it's about having more qualitative outcomes that demonstrates, yes, we're doing it, but we're doing it well.
It's enabling us to take this further and faster and really accelerate the learning, and actually taking that wealth of experience, that wealth of energy to improve our patient care, I think is absolutely critical.
Nurses come into nursing because they want to care, they want to give their best, and sometimes because of the demands and staffing levels and whatever, there's lots of frustration where they don't feel that they can actually do what they really, really want to do. But I think this gives it a framework where you're recognising small bits of what you're doing and saying, we are doing a good job.
E4E has really helped to, I think, clear the mist and show people that there's a selection of tools and resources that you can use, and one isn't necessarily better than the other, and actually depending on your needs at the time and what you're trying to get out of it, what you're trying to demonstrate, they're all equally important, and E4E is the first thing really that's given us that opportunity to do that.
You know, these are our workforce of the future. These are the people that we want to be challenging how we deliver our care and how we can improve on that care. So I think it's critical that at this point in time that we are providing the evidence that where we are making efficiencies in the service, that it isn't impacting on care unless it's in a positive way.
Well, the students are the future workforce, and across the North West it's really keen for us to make sure they are wholly engaged with the drive and the mobilisation of Energising for Excellence. They are the people who will shape the quality of services and care going forward.
I think if I think about Energising for Excellence, and what inspires me is when I'm actually with an individual nurse or a group of nurses and they actually can see that the case for change, what they're wanting to change, what they're wanting to improve for the patient, and there's some action there, they do that. And what we're encouraging around the campaign is that they then share that learning, they share the story, they share the success. And I just say, please, let's carry on and do that.
As nursing curricula is evolving, as services are evolving, and actually those true values of care, compassion, professionalism are embedded in the training of nurses in the future, Energising for Excellence really supports and aligns those nurses to develop those skills and those values and demonstrate better care and better lives to our families, to our service users and to the other professions in the health service.